Hello and welcome to today's edition of Brain Gist. I'm Dr. John Oluwole, specialist neurologist at King's Hospital in Dubai, United Emirates. Right, today I'll be talking to you about how to avoid the pitfalls that can result from overusing pain medications for your headaches. In my last video, I talked about how to use these medications in the best ways possible to make sure you control your headaches on time and avoiding very long lasting headaches. Well, today I'll be putting things in the right perspective to make you understand that migraine care goes beyond just taking these medications, what I call headache relievers, whatever form you take, be it paracetamol or ibuprofen or naproxen or Migraine or via whatever routes. There are limits that you must observe while taking these medications. That's exactly the subject of discussion today. So first of all, I'd like to thank you very much for watching this channel all the time. And I do love those comments. Please keep them coming. And should you be watching for the very first time, this is Brain Gist. This is where I talk about the brain and all other parts of the nervous system and the diseases that can affect them and how to take care of yourself if you suffer from these conditions or if your loved ones suffer from them. This channel helps to equip you or arm you with the right information to look after yourself and all your relations or friends who might be suffering from neurological disorders, because information is very, very cardinal. So again, the topic today is that how do you take these medications in the best way possible to treat your headaches and yet avoid potential detrimental effects on your headaches. The real fact is, even though these medications are known to work to stop headaches when they do happen, if you take them excessively, they can actually cause your headaches to become more frequent. When I see patients in the clinic who have worsening of headache frequency, what I call transformed migraine, in which their migraine headache or attacks are becoming very, very frequent. In fact, I see some patients who have headaches every single day. One of the factors I look out for in the history is how often they are taking these medications, the acute pain medications or the headache relievers. And many of them tend to take these medications beyond what I call the safe limit or the safe threshold. And they actually already tilting into or already falling into that trap of medication overuse headache. So what is medication overuse headache and how can you avoid them? So when you're having to take any of the acute medications beyond 3 times a week, or sorry, beyond 3 days a week, because we've got 7 days a week. So if in total on average, you're taking these medications for up to or more than 3 days in a week, then you're already, setting yourself up to developing medication overuse headache, or what I call, alternatively, I call it rebound headache. So that's like you have a spring and you push hard on it and you push it down to the floor. When you release the spring, suddenly it bounces back and could even overshoot the initial height. So that's what medication overuse headache is. So, and that's the limit. So one should avoid taking these medications beyond 3 days in a week. So the question now is, you might argue that nobody just pops these medications and takes them for no reason, because it doesn't make people high, right? It's not like marijuana or so nobody derives pleasure in taking them anyway. So why would you take them if you didn't have headaches in the first place? So you might argue that people take them because they have need for them. So there are certainly other things to do, which are the right things to do if your headaches are very frequent. And how do I define frequent headaches? For me, any headache frequency that's up to 4 times a month, or let's say 4 to 6 times in a month, is already very frequent, and you should start to consider preventative options. So rather than waiting for the headache to come and you pop in those pills to treat the headaches, it might be just about time for you to start taking some other categories of medications and or interventions that can help to prevent them in the first place. If you recall from my past videos, I established that migraine is that tendency or propensity to have headaches for unknown reasons without underlying disease. So there are interventions, some of them very natural, and there are medications, some of them very natural as well, that can help to reduce or modify that tendency and thereby help reduce your number of headaches in the first place and help reduce your need for those medications. So some of those interventions are lifestyle changes. Hopefully, in future videos, I'll be addressing some of those lifestyle interventions one after the other. And then if those lifestyle medications aren't enough to reduce your headache numbers drastically or significantly enough, then you might need dedicated medications to prevent migraine. And some of those medications are actually natural supplements, which you do not need prescriptions for. And I'll hopefully talk about some of them in future videos. So you've got a lot to gain, if you subscribe to this channel. So please stick to it, and there's so much more to come. So the summary of today's message is you should do your best to not overuse these medications. And then besides these medications causing worsening of headaches, they can also be detrimental to your health. For example, they can harm the kidney, they can harm the liver if overused. But I'm not saying that these medications aren't safe or should not be taken at all. If taken in the right dose and if taken within the right limits, which I've helped to define today, they are very, very safe. So thank you so much again for watching today, and I do hope you learned something. And if you did, please hit that subscribe button. Do not go away without hitting it, so that you can take full advantage of all that this channel has got to offer. And I also encourage you to share this video with your friends and colleagues. You might be helping to improve someone's life. All right, so thank you again. Stay safe and see you in my next video. Bye.